cardiac cirrhosis. So when you see here, this one, it can be a rare complication of heart failure for them to get cirrhosis. I've just combined them all in C, but there is bile duct obstruction, or it can be a complication of severe congestive heart failure. Okay, so just know that there are two separate ones there. Your book will talk about people that have severe congestive heart failure can have cirrhosis also. So I didn't want to wrap it all up into biliary. The two are not related. They have the same kind of signs and symptoms, but this one comes from severe congestive heart failure. Pathophysiology then for our patients, they have inflammation and fibrosis. It causes structural changes and it alters how their liver will function. It occurs slowly over lots of years. They may not even know they have an altered liver function unless they were having testing done, blood work done on a routine basis. They probably don't even know that their liver is getting damaged until they get to the point where they have signs and symptoms. For jaundice, it's usually minimal. They can have periods where it increases and decreases. They can even have an elevated bilirubin without jaundice. Their endocrine system, this is the disturbance that's going to occur due to their inability to detoxify estrogen. This is both men and women. Normally, hormones of the adrenals, the adrenal cortex, the testes, and the ovaries are inactivated by the liver. So any excessive amount that we don't need, the liver does break down. So what are some things that can happen for them? They can get spider angiomas, especially across the neck, the shoulders, and the chest. They can have testicular atrophy or impotence. Men can have gynecomastia. They can have pectoral or axillary alopecia, which is hair loss. And they can have palmar erythema, where they have red palms or the soles of their feet become red. They can have hematological issues, where they have a decreased production of clotting factors, especially prothrombin, and the use and the storage of vitamin K and C. Those can cause bleeding tendencies, nosebleeds, gum bleeding, heavy menstrual flows, prolonged PTs, occult bloods. The spleen is also enlarged and more active. It breaks down more red blood cells. So often there is folate, vitamin B12, and iron deficiencies. Those things can cause anemia, where the bone marrow is unable to keep up, and they can cause leukopenia, which is an increased risk of infection. They can have also thrombocytopenia, where they have decreased platelets. So, what are a couple of the medications that they give to our alcoholic patients? Folic acid, vitamin B12, and iron. Okay, that's pretty routine. Our fourth thing is fluid and electrolyte imbalances. The liver cells do not inactivate aldosterone or antidiuretic hormone. The sodium and water are retained. Albumin is not formed in the liver because you're not breaking down protein properly. It results in a decreased osmotic pressure. This causes peripheral edema, ascites, and muscle wasting. And the muscle wasting comes from a lack of albumin or protein in the diet, because we said they're malnourished. So edema is peripheral, ascites, and then muscle wasting, and that's due to a lack of albumin. Neurological disorders we'll talk about at the very end. And I'm going to let you take a good 5-minute break here, and then we'll come back and we'll discuss the signs and symptoms that are on our drawing here. Okay, so just step away for a few seconds and then we'll be back.